Hi, it's Katherine Watson, and welcome to the Life After 50 show. It's what you need to know for the second half of your journey. I'm your host today, and today's show is sponsored by Find Houston Senior Care, the one-stop shop for everything senior care in Houston, Texas, and surrounding areas. FindHoustonSeniorCare.com helps you to connect directly with assisted living companies, home care, home health, hospice providers, elder law attorneys, and so much more. We have over 500 articles, podcasts, and video shows on the website to help educate you about everything related to senior care. If there's something you want to know and you don't find it on Find Houston Senior Care, reach out to us and we would love to get that information for you. So I'm here today to talk about the two key services that I am really want to make sure that families are aware that they can use these services and Medicare will pay for them. Yes, Medicare pays for that is the title of this show. And we are here today with Angela Cross. Angela Cross works with Encompass Health. And I'm stuttering a little bit because they've changed their names recently. Encompass has home health care, rehab, and hospice care. So they kind of cover a lot of different areas. And these are areas that Medicare does pay for. And for any of you out there who have had the experience of suddenly realizing that an aging parent or another loved one needed help, and you went out to find maybe assisted living or home care, and you found out that you were going to have to pay out of pocket, you probably were shocked because so many people, myself included in the beginning, thought that Medicare paid for that, right? We just assumed that once you got to a certain age and you were on Medicare, that Medicare would cover everything. And then you found out that it doesn't, and you were disheartened. But there are two services that really are underutilized, and that's what we're going to talk about today. They're so underutilized. People need to know that these two services are available and you can get their benefits. And I want to talk about that with Angela. So I'm going to bring Angela into the show now. Just 1 second and she'll be there. And there she is, popped in. Hi, Angela. How are you?
Great.
So let me just tell you a little bit about Angela because I'm really impressed with this lady. She has a long history in the senior care industry. She started off at age 18 working as a CNA. And for those of you who don't know what that is, that's a certified nursing assistant. So basically, she was the caregiver. She helped the families care for a loved one. So she took her roots from that and grew, and now she is the hospice division manager at Encompass Health. So she's come a long way and she's learned a lot. I think sometimes starting at the bottom and working your way up just gives you such a wonderful perspective on everything. And families need that kind of perspective. So I'm excited to have Angela on the show today. She's worked now over 14 years in senior care. Her passion is the palliative care. She believes that everybody has a worth and should have a beautiful and dignified experience when leaving this world. We look forward to talking with Angela today. And we're going to start off, though, with the home health care piece, because I think that's a lot of where people start off. Actually, Angela, if we could, let's kind of take them through the rehab. So say mom has fallen. She broke a hip and she was in the hospital. They did surgery and now she's going to rehab. Angela, if you would just kind of walk a family through that process and what happens during rehab and then after rehab.
So ultimately, rehab is used for strengthening. So once you have had a surgery or have had a significant event where your body has been weakened, rehab schedules exercises, physical therapy, occupational therapy, and works the family through and the patient through what they need to be able to go back home and live a quality of life. And so what they would do is schedule the amount of rehabilitation that they're able to actually perform. So it depends on their specific diagnosis and their specific need, but most rehab facilities such as Encompass Health would require at least 3 hours a day of rehabilitation. So that could be occupational therapy where you're working on specific things related to your activities of daily living, like dressing yourself, getting in and out of bed, going to the restroom, things like that, or physical therapy where you're actually working on being able to walk and being able to perform other, physical activities that you normally would throughout the day, driving, things like that. So.
Yes. I see Jill just came on. Jill, thank you. Yes, we do have a lot of helpful information. If you have any questions, Jill, feel free to put them in the comments below. We'll try to answer them. I'll try to pay attention to the comments. Thanks. Anybody else out there that has any questions during the show today, feel free to put them in there. If we don't get to them during the show, Angela and I will come on after the show and answer those questions for you. So, Angela, does somebody have to have been in the hospital and rehab to then go into home health care?
Not necessarily. A physician order from anywhere can help someone get into home health care as long as they have a need. So if they have a need for something like skilled nursing, where a nurse, an RN, would come out to their home, they can help with going through any changing health conditions. So say they have a new diagnosis, nurse can walk through, here's what to expect. Here are ways that you can help improve that diagnosis. They may even go through their pantry and see, if someone has heart failure, they may see that they have a bunch of canned soup, and we know that sodium is loaded in canned soup. So they may talk through, their diet and nutrition. They may also help with wound care, or they may help with their medications and making sure that they have the right kind of medications, making sure that they have, they're not mixing something that maybe wouldn't react well together. So they would work through all of those things and act as a case manager and actually manage their disease, whatever that may be, COPD, congestive heart failure, Alzheimer's disease, anything that would potentially need a nurse to come in and help manage. If they have a physical therapy need, physical therapy can happen at home. And a lot of times what we found is that being at home is a lot better because they are working in their own environment. So they're learning how to manage being independent in their own home, with exercises, with walking, all of those things. Even something as simple as transferring out of the bed to go to the restroom, things like that. Occupational therapy, same thing. They're working on the intricate parts of your day and getting dressed and making sure that you can manage your care, manage yourself, and continue to improve and get better. Home health also provides speech therapy, and I was a guilty party in not understanding what speech therapy really was, and I've learned a lot just through my experience that it's not just about swallowing, that there's actually a lot of cognitive teaching related to speech therapy. So they do a lot of cognitive testing to see, where are they? Where's their their bottom line, and how can we improve, especially in our patients that have dementia, in learning how to feed themselves again and things like that, because it is possible. There's nothing that's impossible if you work hard enough at it. And so they really work on, defining needs other than just swallowing. We also can offer a social worker to help with any planning or any resources that they may need through home health. And then also a nurse aide. A nurse aide can come out and help with, let's say you did get discharged from a hospital or a rehabilitation hospital, and you need just help in getting a bath because you're not quite where you want to be yet. You haven't quite met those goals that physical therapy has set. And so you need help with getting those things done. And that's what our nurse aide can help with.
So would that be for an extended period of time, or would it be for a set period of time, Angela?
So with the bathing, it's usually a short time frame because ideally when you're on home health, we want you to get better. And so if you're getting better, you want to be able to do that yourself. And so that's ultimately the goal. Same thing with all of the other services that home health provides. Our goals are to get you better and get you independent. And so ideally it's all depends on how you're doing. We set those goals. They do have a what we call a 60-day episode period, but that doesn't necessarily mean that you can only be on home health for 60 days and we're done. It just means that's where we want to meet your goal. And if we haven't met that goal in 60 days, then we're going to add another 60 days.
Okay. All right. So that's interesting. So if you've got a family, say I have a mom and she is living at home alone, and she is needing some extra help. Would a home health care company be what I would need to get for my mom, or would it be something else, or would it be a combination of services?
It depends on her situation. So I think that's a good start, is to get a home health company to come out and assess the situation. And then once you have someone in your home that's assessing everything that she could possibly need, then they can work on making sure that you don't need other services, or if you do need other services, they can help give you those resources. That's why we have such a large team, because it's not just one person that's identifying needs. It's we mentioned 6 different people that it could be. And so I think that it's important to have that second person coming in and saying, hey, I noticed that your mom may need more than just skilled nursing. She may need some exercises to help her get through her home. And so we may recommend physical therapy. Or I noticed maybe mom doesn't need to be home alone, and they may bring a social worker in to talk about home care and caregiving services. And so I think it's important to utilize, every team member in home health care, because they can definitely identify the whole picture, and every individual is different. So what works for one person may not work for the next person. And some people aren't comfortable with a bunch of people coming in their home either, so we would work with
Right.
that. And so again, it's individualized care. Even though Medicare sets a standard for what we should provide, it's definitely individualized on what works for each individual.
Okay. So if you wanted to get some home health care help, what would be the first step? Would it be to go and talk to your doctor? Or is the doctor going to automatically recommend that you should get home health care? Is that something that doctors usually recommend, or do you have to ask for it?
So it varies. We've had physicians actually refer home health when they see a need, and sometimes it's from the family speaking up. I definitely recommend each person, each family, to speak up. If you feel like you need home health services, you feel like it would benefit you, it is definitely okay to ask your doctor. I think that's the first step in saying, hey, I need more help. I'm weak, or I don't understand what diagnosis I have just been given. What is congestive heart failure? What is COPD? I don't understand. And so I definitely think that it's good to have that conversation with your physician to say, hey, I really think I need someone to come in and help. And just, even if it's just an assessment, that home health care company can come in and say, hey, here's what we think you need. And if you're open to it, we can provide it. If not, then, just know that this is an option for you.
Great, great. So I think that's really important for families to know. I know in my experience, doctors just didn't automatically recommend it. We usually had to ask, and we usually had to say, "Hey, I think we need." So families need to be proactive, I think, in the senior care industry. One thing I want people to understand is the difference between home health care and home care, because they're two very different services. And home health care is covered by Medicare. It is task related, like Angela was talking about. They're going to come in and they're going to assess you, and they're going to do certain medically based tasks like physical therapy or speech therapy, or maybe in my mother-in-law's case, she had wound care. She had very thin skin as she aged, as do a lot of elderly, and she would tear very easily. So home health care constantly had to be coming back to take care of those kinds of issues for her. But we also, when she first started needing help, and same thing with my mother, we needed both services, because home health care isn't going to sit there with your mom for hours so that you can run to the grocery store and get the groceries, right? They're not going to sit there and help them. They're not going to take them to the grocery store. They're not going to do a lot of those day-to-day tasks that need to be done that a home care company would provide. So I think it's a good marriage, wouldn't you say?
Absolutely. And,
Yeah.
a lot of it is, concern about expense and things like that with home care. They will work with you. There are tons of companies out there that will work with the family as far as costs and how many hours they can afford. And then what's interesting is Medicare is working on a plan to try to pay for home care as well. So
Yes,
that
I'm
just came
seeing
out in the
that.
news recently.
Yeah.
So that may change next year. So we're really excited to
Mhm.
see that as well. So your next Medicare will pay for that may include home care.
May include, may include. It'll be interesting to see. I have a lot of questions and a few concerns about that. So that's going to be a conversation for a whole nother day. But okay, so we're about at the halfway part. I know we have probably tons more questions and things we could talk about with home health care, but I want to get to the other service that I think is so underutilized, really, really underutilized. And that is hospice care, comfort care. A lot of us have heard in the news this morning, and if you haven't, Barbara Bush has gone on comfort care now. And our hearts and thoughts are going out to her at this time and her family for their challenges and what they're going through. But from a family member who has used this service several times now, I can't begin to say how wonderful it is. I just cannot begin to say. My mother was on it for almost 2 years. When she went home from the hospital, she was given about a 3-month window of, she was going to be gone in about 3 months, but she wasn't ready to go and he wasn't ready to take her. So she hung in there, and hospice company hung in there with us and helped not only her, but all of us. And I think that's the key. You were talking about the team approach with home health care, and hospice has that team approach too. And I love that. So talk to us a little bit about that, please.
So hospice is my passion. So I had a personal experience with hospice, which is what drew me near to getting involved, and I have loved it ever since. So definitely, I feel like as a healthcare professional, you either love it or not so much. So I love it, and so I love the team approach. We have a physician that's on staff that helps with any medications, any evaluations, anything that we need related to a physician to help take care of every person that we have on service. Again, we have that registered nurse that is case managing and making sure that they have everything that they need, whether it's supplies, down to briefs, gloves, ointments, anything like that, or equipment, what we call a DME, which would be a wheelchair, hospital bed, oxygen, um, a even a bedside potty. If they need that, we provide it, and our case manager makes sure that they have all of those things. Even as far as a Hoyer lift, if someone wants to get out of bed and the family is not able to get them out of bed, then we have a lift that we can provide so that they can get them into their chair. So we provide all of those things. Our nurse also helps manage medications to make sure that they have the comfort medications that they need. One of the biggest myths about hospice is that we take everyone off of their medications and only provide pain medications, and that is not true. We make sure that they have everything that they need to manage their disease process, whatever that looks like. If it's blood pressure medicine, if it's a vitamin, if it's cholesterol medication, any of those things, we keep them on there. Now, that doesn't mean that we cover all of them. It just means that they will continue to be able to get those. We also provide a nurse aide in hospice care. And in hospice, the difference between hospice and home health, our hospice aide can come out more. They can come out often. They help change the sheets. They help with bathing. They help with grooming. They may even take the trash out of the room, things like that. They do a little bit more. And if someone's not really feeling up to a shower, they can give a bed bath. If they're not feeling up to a bath at all, they can rub their feet. We have some wonderful, wonderful nurse aides on our team, and they even sing to them. If they don't feel like being touched, they'll just sing to them.
Yeah.
Making sure that they have whatever's comfortable for them. It is comfort care. So we meet the family and the patient where they are. We also provide a social worker to help with resources. Sometimes it's overwhelming and a family needs respite. And so we can provide what we call respite care for 5 days. So that sends that person to a nursing facility for 5 days so the family can get a break. Just because they're caregiving for someone doesn't mean that they don't deserve a break. And we want to make sure that they have that break and so that they can get right back to caring for their loved one. The social worker also helps with other resources like making sure that they have a DNR or an advance directive, making sure their will's taken care of, getting them the right people that they need to take care of that. If they can't stay at home any longer and the person that's caring for them just can't care for them any longer, they help make sure that they have assisted living or nursing home options available for that family. So they really have great discussions in making sure that they have what they need. We also have spiritual care through our chaplain, and we really believe that it's not just a physical need when you're involved in comfort care. It's physical, spiritual, and emotional. And so our chaplain offers that spiritual support from any religion, any background. They're non-denominational, so they'll make sure that they get what they need depending on their culture and their beliefs. And we know that, just for example, we've had a Buddhist family on service, and they don't believe in touching someone when they pass away. And so we make sure that we abide by those rules and making sure that we're respectful to whatever it is that they need to grieve. And so we also offer bereavement for 13 months after someone passes away. That is huge.
It is. It
You get through the
is.
first birthday, the first anniversary, the first holiday, the first ice cream date, whatever it was that is important to them. We're going to call and we're going to send notes, and we're going to invite them to have a meeting with us to make sure that they're really truly okay. I recently experienced some grief in the last couple of years, and it hit me on my own birthday because I didn't get a phone call from that person. And I think that those are things that we don't think about if we haven't faced those things. And I'm really, truly glad that I was able to face that so that I truly understand what our families are going through. And to me, the bereavement piece is very important in making sure that they have the resources that they need, even if it includes counseling or support groups or anything. That we can do to help them, because it's not just comfort care for the person that's on service, it's comfort care for the family as well, because the family is who's left.
Right.
And so
Exactly. And
yeah.
one thing I want to point out too is for those who don't understand, Hospice care can be delivered wherever you are.
Mm-hmm.
It can be in your home, if you're in assisted living, if you're in somebody else's home, if you're in a nursing home. It doesn't matter where you are. They come to you. A
Yes.
lot of people tend to think hospice is a place that you go to. Not necessarily. Most of the time, the hospice company comes to you wherever you are. And I know as a family member, it was such a comfort to know that when I wasn't there with my mother-in-law, somebody else was popping in. And they would send me texts and they would let me know how she was doing when they popped in and, what was going on, good or bad. I told them, I said, I want to know what's going on, the honest truth, and they were very helpful with that because that gave me, barometer. Okay, she's having a really great day. Maybe I don't need to come right now. I'll come a little bit later. Or she's not having a so good day. So maybe I need to make some extra effort to come and visit. Those kinds of things were very helpful.
Absolutely.
Yeah. And again, I want to stress that, a lot of people wait until the last minutes or days to get on care. And it doesn't have to be that way. If you think that it is in the foreseeable future, you need to reach out and at least get an assessment. When I thought my mother-in-law was getting ready, we had an assessment and they said, she's not quite there yet. Keep an eye on her and we'll come back. And so they did. And about 2 months later, things took a big turn and she was ready. And she ended up being on the service for about 7 months. And we couldn't have done it without them. We just couldn't have done it without them. They were such a help, such a help. One other thing that I want to stress is that families need to be able to choose the company that they want to go with. A lot of times people ask me, they say, does the doctor or does the nursing home, not nursing home, the hospital have the right to tell me who to use? No, they don't. You should choose your own. And I recommend that you interview a couple of different ones. Don't go crazy. Don't try to interview 20. You'll drive yourself nuts, but interview 2, maybe 3 tops. I wouldn't do any more than that, and see which companies you feel like you connect with better, because both home health care and hospice are very personal services, and you want to have that.
Absolutely. And everyone is required to offer the same type of service, whether it's home health or hospice, but not everyone's required to go above and beyond. And it's definitely important to gain that trust and gain that connection. Right. Because like you said, it's a very intimate care process. And so we want to make sure that that we connect and that, that you're comfortable asking questions if something doesn't sit right or whatever the case may be. If you're like, I don't understand this medication, or I don't understand why certain things are happening to mom or dad, it's important to have that connection with your team to say, hey, please help me understand this, instead of feeling uncomfortable.
Yeah, exactly. Angela, somebody has made a comment. They've asked if you could please explain Medicare changes for coverage to physical therapy in home and out-of-home visits. Apparently, it isn't capped this year. And I did hear something about that, too, about the caps changing. So tell us what you know about that.
I'm not 100% on that. Hospice is more my specialty. I have heard some buzz about that. I think that what that's doing is it's offering the availability for more visits. And so I know that there's usually, they've been very specific on, if you're not meeting the goals, then we need to look at comfort care. If you are meeting the goals, then we need a discharge. So I think that's just offering more opportunity.
Okay. Can we do this? Can we get somebody from the home health care side at your company to come in and answer Sherry directly?
Yes, absolutely.
That would be great. Seconds. Yeah. You don't have to do it right this second.
Oh,
It can be right after the show, but just
okay.
after the show, have somebody come in and just, Sherry, they're going to answer your question. And if you have more questions, you'll have a connection of somebody that can help you.
Absolutely.
Okay.
And I'm here in the office now, so as soon as we're finished, I will grab somebody from the home health side.
Great. Sounds good. Thank you so much for being on the show today, Angela. Unfortunately, it's gone by quickly. It is 11:30, and we could have talked for hours. I think about different things on this show, and it looks like we've had quite a few people showing up to watch this, so that's good. Anybody that has any questions, please put them in the comments below. We will be more than happy to get those answers to you. I will be watching the page, whether you're watching this show live or maybe you've tuned in after the show broadcast and you've watched the replay. Feel free to put your questions in there, and I'll make sure that somebody gets you an answer. Okay. Again, thank you, Angela, for being on the show today.
Thank you for having me.
Put Angela back in the lobby, and I want to tell you what we're going to have next week. So we are bringing back Dr. Julie Kutak with the Alzheimer's Association. She'll be on the show next Monday, and we're going to have a discussion about dementia and getting an early diagnosis, why it's so important. So you don't want to miss that show. Join us next Monday. And if you would like to be a guest, if you have some information that you think would be helpful to viewers of this show, please fill out the application at Find Houston Senior Care. I'm putting the link up here now so that you can do that. We're always looking for good experts to come on and talk to us about subjects that families need help with. So if you're over 50 and you have some information or you need some information, let us know what you're needing. Let us know who we can get to help you. Have a great day. And again, we want to thank Angela for being on the show and Encompass Home Health for allowing her to do so. Have a great day.